Did you know that Medicare won't pay for long-term care? Many Americans believe Medicare will step in if they need care in a nursing home, assisted living, or help at home. The Medicare and You book, Medicare sends out every year, will tell you on page 55 that long-term care is not covered by Medicare. Medicare was never designed to pay for long-term care. Medicare is health insurance. It's designed to help you get healthy. Medicare only pays for skilled short-term care or rehabilitation, and only if very specific rules are met. So you must be hospitalized at least 3 days. Check out page 29 if you want to learn more about that. That means that the care that you receive, it's from a skilled physician. The coverage in rehabilitation is limited to 100 days. The first 20 days is covered by Medicare 100%. After day 20, you pay copays every day. If you have a secondary plan, such as a Medicare supplemental plan or a Medicare Advantage plan, they're going to help you pay copays, and they'll tell you what they are. It just depends on what kind of plan you have. After day 100, you are 100% responsible, and skilled care can be $500 a day. So Medicare is not going to pay for assisted living, custodial care, long-term nursing home stays, or adult daycare. That's why Medicaid is the main payer of long-term care in the U.S. Medicaid pays for about 45% of all long-term care in the U.S., far more than any other source. So, to qualify for Medicaid long-term care, you must meet 3 requirements. You must have a medical need. You need help with your activities, daily living, or experience memory loss, have a cognitive impairment. 2, most of your monthly income will go to pay for the care that you receive. And 3, your assets cannot exceed $2,000. That means you must spend all of your savings, all of your investments, all of your retirement accounts spent down. That's called the spend down. For many families, it means financial self-destruction before help arrives. This is why Medicaid planning is so important, because some assets are protected, such as your primary home within limits, 1 vehicle, your household items, and your personal belongings are exempt, and a small burial arrangement. But after death, even protected assets may be taken back through Medicaid estate recovery. Yes, even your house. However, married couples have critical protections. If one spouse needs care, Medicaid has spousal protections, such as the healthy spouse can keep their own income. They can keep up to a certain amount in assets, and that varies by state. This prevents total spousal impoverishment. But these rules are complex and mistakes are costly. The 5-year look-back trap: if you try to give assets away when care is needed, Medicaid's going to look back 60 months. They'll look back 5 years. If Medicaid finds out that you gave away assets, that can create a penalty. And penalty periods are where Medicaid pays nothing until that penalty period is over. It's usually a number of days. Your family is going to have to pay for care out of their pocket during the penalty period. This is where many families panic, especially if it's too late. So Medicare's not going to help save you, and Medicaid will, but only after financial devastation, unless you plan ahead. Planning before a health crisis is the only way to protect your assets. Planning ahead is the key, so you've got to take steps now. We have videos on asset protection on our channel. There's lots of information there. You can also check out our Asset Guard Organizer. This booklet is going to help you secure your financial information when it's time to apply for Medicaid. There's going to be a link in the description. If this video's helped you, hit the like and subscribe button for more guidance on planning ahead for long-term care. Have a great day.